Alright, so this is one of the most important exam recall discussion regarding NEETPG 2022, recently conducted on 21st of May 2022. In psychiatry, this time there were 4 questions, and the questions and the answers have been shared by myself on Facebook, Telegram, WhatsApp groups, etc. So this is a recall video explaining you the answers. Out of the 4 questions, we had 2 clinical questions and 2 questions related to psychopharmacology. Okay, one was related to substance use and another was antidepressant poisoning. Now, out of the 2 clinical questions, one was pretty simple and one was a little trickier. So that's why this video is here to explain you the answers of the 4 questions. So here we go. The first question. A woman would get anxious, mood swings with occasional sleep disturbance and weeping episodes after the birth of a child and got referred from obstetric department after 5 days post-delivery. Most of the students I've spoken to after the exam have marked it correct. The key word being 5 days after delivery, little anxiety, little mood lability. It is postpartum blues. The answer of question number 1 is postpartum blues. So it's not depression because the duration is not up to 2 weeks. It's not psychosis. We don't have any element and there's no specific condition called as postpartum anxiety. If you remember this chart being shown to you in most of the classes from the concept book, postpartum blues happen within days of delivery. The predominant symptom are labile mood, tearfulness, always less than 2 weeks. So the history will always be in days. And the treatment is, it is a self-limiting condition. PP depression, depressed mood more than 2 weeks, guilt, anhedonia, suicide attempt, help-seeking behavior for the child, antidepressant, rarely we may require ACT, and postpartum psychosis. Okay, so that's depression with delusion against the newborn. So the answer was very straightforward, that was postpartum blues. It's solved correctly by more than 90% students who have written the exam as per post-exam survey. Now this was the only tricky question of this time psychiatry. Now I have got numerous recalls, more than 1,000 students have recalled it for me. I've tried to discuss on Telegram, WhatsApp, Facebook. This is the language which I have got. 16-year-old female presents with a physician with irresistible urges to eat. Some students said urges to eat was there. Some students said she had craving for food. She was eating followed by episodes of vomiting. So it is binge and compensation. Now the use of appetite suppressant drug was mentioned, and this statement confused the student that whether it is avoidance. No, it's not avoidance. It's also a part of compensation. Have a look at the diagnostic criteria of bulimia. It's a screenshot from concept book itself. Excessive eating, desire to eat, then counter by using appetite suppressants. Point number 4, appetite suppressants, use of drugs such as appetites. So appetite suppressants are used in bulimia as well. The students were knowing that avoidance is a feature of anorexia. There was no avoidance mentioned in this question. It was eating compensation. That's all. Simple. Bulimia. Eating. Some students were saying BMI was mentioned. Some were saying weight was mentioned. But when I asked many of students, they said no BMI, no weight. Only 3 informations in this question. Eating, vomiting, appetite suppressant. Eating, vomiting, appetite. My answer for this question is bulimia nervosa. I have discussed with my colleagues of psychiatry teaching across various platforms, and most of them are convinced that answer is bulimia nervosa. Bulimia nervosa. Okay. Even in anorexia, you have appetite suppressants being used. Yesterday when I was checking the anorexia diagnostic criteria in the Kaplan-Sadok textbook, I found in anorexia also appetite suppressants are used. But the most important criteria is low weight, low BMI, then avoidance. Avoidance is the hallmark of anorexia nervosa. In this particular question, there was no avoidance. It was only binge and compensation. Appetite suppressant is a part of compensatory behavior, and it is included under bulimia. So the answer of this question number 2 is bulimia. Third was a very simple question, opioid overdose. In the lectures you have been given a handout of substance use disorder. If you have a handout, open it up. In opioid there is written drug of choice for overdose, answer naloxone. naloxone 0.8 mg per 70 kg body weight. And opioid causes respiratory depression and naloxone reverses the respiratory depression. It's an opioid antagonist. Okay, so naloxone, this question again has been marked by most of the students correctly. Opioid overdose naloxone, opioid anti-craving naltrexone. Okay, overdose antidote is naloxone. Okay, naloxone. Fourth and last but not the least question, I believe it's a repeat question from AIIMS 2015. Quite similar, not exactly similar, quite similar. Patient on antidepressant present with altered sensorium hypotension. Most important, ECG changes. Antidepressant which causes ECG changes on overdose is tricyclic antidepressant, and it's mentioned in the textbook that to reverse the ECG changes of a tricyclic antidepressant we use soda bicarb. Although it looks like an anticholinergic toxicity, so some people say give cholinergic like physostigmine, but in textbook it is mentioned that to repeat the ECG changes, to revert the ECG changes caused by TCA, tricyclic antidepressant poisoning, the best drug is soda bicarb. Similar question of AIIMS 2015. That's why I always stress upon doing repeat questions. This AIIMS 2015 question, if you would have done probably before the exam, you could have easily solved this NEET PG 2022 question. So that's all about NEET PG 2022 psychiatry. That's all in this video. If you have any queries, comments in this YouTube video, if you are watching, please comment on how much you scored or how was the 4 questions. Did you understand? If any queries, get back to me. Thank you very much.